Hey, welcome everyone. Good morning or afternoon. I'm Bethany Hamilton, Director of the National Center for Medical Legal Partnership, based at the George Washington University. As folks join us today, I'll go through some very basic information to open up today's webinar training series. So again, today we're welcoming you to another installment of the Health Center MLP Planning, Implementation, and Practice webinar series. This is presented by the National Center for Medical Legal Partnership in partnership with Texas A&M Health Institute for Healthcare Access. Excuse me. You are joining us on the fourth installment or fourth webinar of the series, where we are going to discuss the burning question: how are we going to pay for it? And in today's webinar about how to pay for that medical legal partnership, we're going to walk through lessons with regard to budgeting for a medical legal partnership and then identifying sources of funding. So welcome. Today's March 28th, 2024. Let's go to the next slide. Again, as people continue to join, I'll walk through some housekeeping. Everyone is joining today's webinar on mute, but this is an interactive webinar series. So in addition to using the Q&A function within Zoom to submit your questions, we welcome you to submit questions and comments using the chat. Send a chat to us if you need any technical assistance. Don't forget to select host and panelists. And also at certain points during the webinar, you should be able to, we'll ask you to unmute so that you can engage. If you do need to activate captions, using Zoom, select live transcript and then show subtitle. The answer to the other question we know everyone usually has is this webinar will be recorded and we'll share it on the National Center's website, medical-legalpartnership.org. Let's go to the next slide. As I mentioned, at certain points during today's webinar, because we are interacting with the audience during this virtual training series, we will have this icon on the slide indicating that it's time to use the raise hand feature on Zoom so that we can select you from the audience to unmute and speak. We'll be asking for people to contribute their ideas, comments, and experiences so that others can learn collaboratively. Next slide. You'll also hear us using a lot of acronyms, abbreviations, perhaps, a lot of alphabet soup. So just as a reminder, when we say FQHCs, we are talking about federally qualified health centers. We may also interchangeably refer to some of these health centers as community health centers or CHCs. If we say MLP, we are talking about medical legal partnerships, some of which use a slightly different set of terminology like a health justice partnership or alliance. And you may also hear us referring to federal agencies such as HRSA, or the Health Resources and Services Administration, and LSC, or the Legal Services Corporation. There might be other alphabet soup named or used throughout the session. So if you have a question about something that we stated, feel free to ask us what we meant by something using the chat or the Q&A. We're happy to define what we're talking about. Let's go to the next slide. So speaking of HRSA, this project, this entire webinar series and several of the additional resources that folks see on these national audience webinars, supported by the Health Resources and Services Administration. The National Center for Medical Legal Partnership is in its 10th year as a cooperative agreement partner to provide training and technical assistance to primarily, because of this project, health centers, staff, and organizations, but also their partners, such as legal aid organizations or law schools. This is, again, national audience, so everyone is welcome, and thank you all for joining today's webinar. Let's go to the next slide. All right, so once again, just in case you're joining us new to this webinar series, we kicked off in February. We'll be wrapping up in June. And we are partnering at the National Center with Texas A&M University's Institute for Healthcare Access to offer this webinar series to help health center-based MLPs plan, implement, and practice. This is based on our seminal resource called the Health Center MLP Toolkit. We really encourage everyone to utilize that toolkit as we walk through various sections. Again, it's an interactive series. So we will encourage you to use active learning, and we're going to purposely design polling features as well as questions during which, again, we'll unmute Mike so that you can speak and engage. You'll see in the chat that Reha, our Senior Research Assistant here at the National Center, just plugged a link to the Health Center MLP Toolkit. So go ahead and download it now so that you'll have it handy, and feel free to pass it along. Let's go to the next slide. Okay, so as I mentioned, this is interactive, and we have our very first poll. So we'll go ahead and launch the very first poll. You all should have on your Zoom screen our first icebreaker poll. We just want to see who's joining us again here today. So first, what type of organization are you from? Go ahead and let us know. Are you from healthcare, legal services? Perhaps you're from an academic institution. If you're from other, answer that. We'll probably also ask you to go ahead and put where you are from. If you're in the other category, let us know in the chat. Question number 2, does your organization have a medical legal partnership? Yes, no, or perhaps you don't know, and that's okay if you're not quite sure yet. Let us know what you do or don't know by your MLP status. And question number 3, if you do have a medical legal partnership, which sectors currently fund your medical legal partnership work? If you don't yet have an MLP, which sectors do you reasonably anticipate will fund your MLP work? Legal, health, academic, or something else? So we'll give folks a chance, just a few more people, to answer the poll. Again, let us know what type of organization you're from. Does your organization have an MLP? And then the third question pertains to which sectors currently fund or do you anticipate will fund your medical legal partnership work? We'll close out in about 5 seconds and see the results. Okay, Reha, let's go ahead and close out the poll. We're sharing the results now, and you can see that about 48% of today's attendees are from legal services. Welcome back to the legal services community. In healthcare, you come in second place. Thank you so much for joining us again. We have folks from academia and then the other category. So really curious to see who from the other category is joining us today. If folks take a moment to please let us know if you fell into the other category, who are you? That would be great. Everyone in the chat is open, so let us know. About 76% of you have a medical legal partnership. So thank you so much for joining us to help advance that current work. And for those who are newer to the series and to this practice, and said, no, you don't have an MLP, we hope this is helpful. Let us know in the Q&A and chat how we can also continue to assist you with your MLP planning and implementation work. For the funding question, and I'll definitely ask Keegan to comment on this. You'll hear primarily from Keegan Warren on today's presentation, but it's really interesting to see the breakdown in terms of funding. About 48% of the respondents indicated that the legal sector is funding MLP work. 70% of respondents said that the health sector is supporting the MLP work or anticipating that that's where funding will come from. And then 11% from academia, and then the other category. Really interested in seeing what the other categories are indicating. So thanks everyone for answering the first polling question. Rahel, let's go to the next slide, please. All right, again, we are in conversation number 4, or part 1, conversation 4 of the Health Center MLP Toolkit, as we carry on with this particular MLP PIP webinar series. Next slide, thank you. So today's learning objectives, as we talk about how we're going to pay for it, are as follows. First, we're hoping that by the end of this webinar, you'll be able to better describe some common sources of legal and healthcare funding for medical legal partnerships. We also hope that you'll be able to evaluate to what extent your budget captures all of the revenue and expenditures. And then finally, we hope that you'll be able to assess how your budget might better reflect programmatic values and ensure sustainability for your MLP. Next slide. Again, we are joined by lead faculty Keegan Warren, Executive Director for the Institute for Healthcare Access at Texas A&M University Health Science Center, and Adjunct Professor Jay Sicklick, who's Adjunct Professor at UCONN, and also former MLP Director of a Connecticut Pediatric MLP. And I'm Bethany Hamilton, Director of the National Center for Medical Legal Partnership. Also with us on today's webinar, if you need any assistance, is our senior research assistant, who's a data scientist, Reha Manikandasamy. So you're welcome to send us an email if you have any general questions or need assistance, and then Reha will help triage the questions that are coming in or the requests for support to those of us who are leading the webinar. Let's go to the next slide. I'll do a quick session 3 recap before we dive into today's session 4 presentation. Let's go to the next slide. So if you joined us on session 3, presented just a couple of weeks ago, we talked about the staffing of the legal services aspect of a medical legal partnership. And you heard from Professor Jay Sicklick about what are some of the challenges or the benefits to directly hiring a lawyer or contracting with another organization for those services. You'll see in the chat a link to the archives of that presentation, and you'll see on the screen some of the learning objectives. We identified models employed by MLPs with some of the historical perspective. We compared and contrasted the 2 different basic models, direct services or contracted model. And then we explored the variations and implementations of the staffing models and determined the efficacy of those models in different types of sites. Let's go to the next slide just to display what this looked like as we walk through it. The direct service model was where you're, as a healthcare organization, a health center, or even a hospital, you're really deciding, hey, we're going to build this internally and embed the legal services team into our on-site service delivery model. Let's go to the next slide. And we also explored the more commonly utilized model, which is the contracted model, where the healthcare organization is partnering with another outside entity. They may also similarly embed by providing some space within the healthcare setting for the legal services team, but you're still treated as 2 very separate, different organizations partnering to ensure that your screenings and your referrals and the intervention and the closing of the loop are done between those entities in an effective way that we call medical legal partnership. All right. So again, the archives of the past presentation are available at the link that is in the chat to our website. But now we're going to dive into conversation 4. I'll pass this on to Keegan Warren to present on how are we going to pay for it. Keegan, all yours.
Thank you so much, Bethany. One observation I have that last conversation about staffing is extremely important and linked to today's conversation, because your staffing model may well impact your funding options. So I want to talk a little bit about our framing for today, but I want to start first with a bit of interactivity. So I'm going to ask you all to pull up the chat function. And I want you to answer in a word or a phrase, a singular question. And that question, if you're ready, is what are budgets? What are budgets? So in the chat, yeah, make that chat move. To answer the question, what are budgets? In a word or in a phrase. No paragraphs here. We're not writing an essay. I want to have a sense of what you all think is key about a budget. So I see funding guidelines. I see planning. A budget is a planning document. Lots of folks think that. Confusing. I love it. I think that is a really important admission. Lots of folks say financial plan, allocate resources, how money will be spent, parameters. That's interesting. Anticipated revenue and expenses for the coming year, planning, long lasting. P&L, little inside abbreviations from the finance world here. Resources available to complete activities, to meet goals. Restrictive, well, that's interesting. Strategic priorities, an estimate of expenses and revenue. Wow, thank you for that. That is, there's so much there. I'm gonna go a little, not exactly off script, but does anyone want to unmute and explain? I'm particularly curious for folks who used maybe unusual descriptors, like parameters. Allison, would you want to tell us more about that? Or confusing for that matter? The other folks that I would love to hear from are anyone who wants to talk about this as a strategic priority.
Am I unmuted?
Yes.
Okay. I just said parameters because I think it really kind of your budget sets like what you can and can't do. And then depending on where you're getting your funding, there also might be kind of expectations or guidelines or restrictions on what you're able to spend it on.
Yeah, absolutely. I love that. And right, these weren't mathematical parameters. These are if I'm understanding you correctly, what you're thinking of, and what I suspect some other people, especially the folks who are like, this is about strategy, are thinking of is not the addition and subtraction of, say, the cost of an attorney. Now, it's really critical, and we'll talk a little bit more about that. But I really love that we're starting in this place where we recognize that a budget is an opportunity, right? It's not merely a spreadsheet. So if we could go to the next slide, this was part of our internal conversation about how we wanted to frame things for this conversation. And what struck me was that essentially what we're asking is that kind of age-old question of which came first, the chicken or the egg, right? So in discussing today's question, right, our big question about how we're going to pay for it, I think that I would invite everyone to think about, for your MLP, what is your chicken and what is your egg? And what do I mean by that? Well, if we can go to the next slide. I want you to think about whether you start with a budget and then seek financing that accords the ideas that are reflected in that budget, or do you accept funding and then tweak your budget to match? Now, my guess is that most programs do a bit of both, but that maybe there's opportunity to be more intentional about that interplay, right? That without intentionality, there is tension that makes it hard for our programs to be exactly as we might envision them, right? So I'm going to torture the chicken or the egg analogy just a little bit, because I find it amazing that we have this kind of idiomatic question, and yet research tells us that the egg came first, right? And the idea here then is we have to pick a place to start our conversation today. And so we decided that our egg, the thing that comes first, is actually the question of budgeting. And that although we're starting there, the goal for the next hour or so is not a discussion just in terms of the what, although we need that lens. So we're definitely going to start there, or even how much, but rather the why of your programmatic funding needs. And we saw that reflected in our Chatterfall activity that we did, right? Plenty of y'all already understand that there is opportunity to think about a budget, not just as a financial planning document, but also as a strategic planning document. And that's really key for sustainability. We will also continue to talk about this idea of strategy and sustainability, of course, in future conversations. But let's see if we can link these things together by starting with the what. So on the next slide, we're going to begin to answer what is part of your medical legal partnership budget. So in thinking about what goes into the budget and how that can help us get closer to a sustainable program, how it can reflect our strategic values, we want to note that the goal here is to talk about all costs, whether they're direct costs, those kinds of things that are fundamental, that are foundational to your program, or whether they're indirect costs, things that don't necessarily stop the work, but they probably prevent you from growing the work. So we're going to go through 4 categories of these. We're going to think about this in terms of legal staffing, in terms of health center champions, in terms of other staffing, and then other types of expenses. But again, I want this to be a conversation. So each of these is going to be presented as follows. We're going to kind of go through what the common components are, and then we're going to do a poll. because I want to know how many of you are including all of these. And then we're going to have a bit of a dialogue to see who's doing something else. Who can we learn from as a cohort? All right, so let's begin. So we're going to start with legal staffing. Of course, legal staffing is absolutely key to medical legal partnership. It is so key, in fact, that we often hear the MLP legal team being conflated as though it's the entire partnership, right? It is MLP. I think that misses the moment a little bit, but that it makes sense that that would be the tendency, because legal staffing is the pinnacle of a direct cost. It has to be captured in the budget, right? It's meaning that it's as a direct cost, meaning that it is the kind of expenditure that is necessary for the MLP to exist. And I think that's part of what causes some of the language confusion that can result in missed opportunities. So what is the legal staffing expense? Of course, it's not just salary, but fringe. Some programs occasionally forget that that we want to capture all of the costs of legal staffing. But look at the bullet points, right? The activities of the legal team vary, which you all know or suspect, especially if you're from a legal services or legal sector organization. But the most effective budgets will allocate not broadly to, say, attorney, right? Not just a flat dollar amount, but will also reflect those activities that you want to do, because these are trade-offs. No one attorney or paralegal or even an entire legal team can do all of these equally well or equally in terms of time. And so we want to make sure that the budget reflects the activities that you mean to do. And then as you're engaging in regular review of your budget, which if you're not doing, you should do monthly or maybe quarterly, but certainly more often than annually, that you are comparing, taking that opportunity to compare whether your projected ideal of what this work looks like for the legal team is actually matching the reality of how it played out. Now, if you look at the staffing list in this first panel, you'll notice that we mean very much to emphasize that you want to capture not just the cost of the attorney, right, in terms of salary and fringe, and paralegals and legal assistants, but also the in-kind value of volunteers like pro bono attorneys and law students, as well as supervision of the same, because that often falls to the MLP legal team. And if you've ever worked with pro bono attorneys, you know that because this may not be the kind of case that they're handling all the time, there may need to be actually more supervision and more interactivity, more communication than with a regular staff attorney, right? We want to capture all of these things. In our second panel, legal technology experts are called out. So often when folks want to partner consistent with this MLP model, they forget that because it's a blending of two sectors, that you really want to be deliberate to think about things like information sharing and data collection, not as a matter of individual patient clients, so that's certainly important, but organizationally, right? Because that probably looks different as a legal services organization partnered with a healthcare services organization, rather than just as a legal services organization. If you're just a legal services organization, you're probably quite fluent in responding, for instance, to legal services funders. And what all of that means, at minimum, is thinking about, in the context of your budget, startup funding to modify your case management system. Now, many organizations probably do this in-house, but perhaps especially if you have Legal Server, which has an MLP module, right? It has those MLP specific fields and has a whole guide that we can point to you to as well. But many other organizations may choose to hire a third party. Mallory Curran Consulting comes to mind, who specializes in MLP legal technology. But regardless, the point here is that a budget is an opportunity to capture the time and the value of this work, because it's additive, right? It is generative in terms of the ways that it furthers your sustainability plan. Now, lastly, in the third panel here, I suspect that almost all legal services organizations that are partnered with healthcare have a supervising attorney who is not an on-site MLP practitioner. That person still is perhaps doing case review or relationship management or network building or other tasks that are key to sustaining the MLP. And that's a serious value proposition that's within that manager's efforts, and it should be reflected in the budget as well. So with that bit of overview, let's do our next poll.
Keegan, can I just?
Oh, please.
I'm sorry.
While we're answering the poll,
yeah.
Jay, please jump in.
No, I don't want you to. I can't overemphasize the point that Keegan just made about this, about attributing cost to the supervisory personnel in the budget. Whether or not it comes to fruition is another thing, because that's the chicken and egg question. But putting it in the budget is critically important for so many reasons, which I don't need to extrapolate on too much here, but identifying the amount of time that the supervisory personnel will be putting into the MLP, not just for direct supervision of the work, the legal work that the individual or group of attorneys is going to be providing, but also the liaising with the health centers or the administrators or the outside funders, because it's a lot more on the individual plate than you would assume. So whatever it is that you want to put in terms of supporting a person's time in the budget is really important. Just make a little asterisk in your budget calculations that you really need to keep this as a right up front in the window as you start doing this. Anyway, sorry for interrupting the poll.
No, not an interruption at all. Thank you for that. And please continue to provide supporting comments. So I think we've got roughly half of folks who have weighed in and with our poll. And not surprisingly, 100% of you are including your MLP lawyer and your paralegals, but fewer than half are capturing the value add of pro bono attorneys or law students or anyone else who's volunteering to do work. That means there's something you're losing there, because that is work that is additive to your program. Legal technology experts, we dropped down to almost a third of folks who are including the work of keeping the technology running. That, of course, means 2/3 of folks are not capturing that is a cost. It is a trade-off for someone to make sure that legal technology works. And I don't have to tell you all that we haven't, as a society, funded legal technology to the same extent that we have medical technology. And so I suspect that as you're having conversations with if your legal services, with your partner, regardless, talking about what that looks like is really an important opportunity, not just for the budget, but also for knowing when you've achieved success. And then finally, as Jay so helpfully added, this importance of including the managing activities. Looks like we've got a little over half of all people who are doing that. So fantastic. I love that there are so many of y'all who are already starting to think through these other types of revenue, if you will, that are not financial, but they're still services that are additive, that are generative of the work that you're doing. Who's doing something else, though? We know our list is incomplete. We know that there is incredible innovation happening every day in MLPs across the country. So if we could get someone to unmute, then that would be great. Who has something else that they are adding in terms of legal staffing to part of their budget? Oh, Marie, thank you.
Hi, we, and for the first time ever, and as part of a grant, built in money for an outside evaluator, and I can't tell how excited I am about it. And I hope that it will be, and we're hoping to be able to capture in collaboration with one of our partners some health system metrics as well as some legal metrics. So yay.
Yes, yay, absolutely. Thank you for sharing that. So an evaluator, someone who is a third party who can come in and help make sense of this work, help you define where you're successful, help you find opportunities to grow. That's an amazing part of a budget. And as Marie said, right, this took third party funding. But if you don't recognize that opportunity within your budget, it's hard to know when it will appear, right? So this is part of kind of prospectively budgeting, thinking about the things that you would like to do as part of your budget now, even if you don't have funding for them, right? It tells you that when you see those opportunities, that you'll be ready to take them. Christina, what are y'all adding?
We add some extra funds for folks back at the office to help us with some cases. So our on-site MLP attorneys do a lot of brief services, but sometimes extended services, or in some special areas of law, like fair housing, for example, will refer to other units at the firm. And so we've added like 10 to 15% of an FTE to help cover those costs.
Yeah, I think that is that's so smart. Who can I ask you, Christina? Although I'm gonna ask everyone this later, but I want to ask you specifically. Who are your funders?
So the MLP we started it, our funder is a hospital system.
Okay. I think that's particularly important in that case. And I hope that everyone else hears this this wisdom that you are offering, is that particularly when you are a legal services organization and you're receiving healthcare funding, helping them to understand through this budgeting process that one attorney can't handle all the types of cases, they can't do all of the work, and that their buy-in is not just what the costs are for that one person, but they're getting access, potentially prioritized access to a whole organization of experts in a variety of fields that may not be deliberately or traditionally connected to health, but that no doubt are unmet legal needs that have an impact on health, right? That's absolutely terrific, and I think it is an opportunity for anyone who's not doing that, who's not including all of the extra work this creates for the organization in terms of legal cases, to include that. And again, what that does is as part of your budgeting conversation, it turns this into a recognition of how much the legal services organization is contributing. Okay. We have some other comments in the chat that folks can take a look at that are also quite brilliant in terms of thinking about all of the contributions, the cost to the legal services organization, and the revenue, and again, not just in a financial sense, what the benefit is to the MLP. Okay, so let's go to our next category. And this time we're going to turn to the health center, right? After all, MLP, the P stands for partnership. This is not just legal services, but rather legal services in partnership with healthcare services. So very often, health center staffing for the MLP, right? Doing the work of the M, will be in kind. And it's often focused on champions. So that's where we're going to start, but you should already anticipate that I'm going to ask you who else. You may recall from our second session that champions are staff ideally with protected time that is dedicated solely to helping to ensure the success and sustainability of the medical legal partnership. So champions are often defined by their fundamental role as an employee of the health center, but generally include kind of three broad categories, right? The clinician champion, this is someone who provides leadership around and guidance around systems. They may participate in trainings, but broadly, they act as a bridge to the rest of the clinical staff. So it's not uncommon for your whole MLP champion team or your leadership team to have more than one clinical champion. You may have a physician champion, a nurse champion, a clinical social work champion, et cetera. And that can be particularly helpful where there are distinct workflows or patient service lines that have unique interactions with the MLP legal team. Regardless, having a clinician champion can be really helpful. Second is the administrative champion. This can be a really key champion to have someone from the C-suite, so to speak, or a designee who's able to provide leadership and guidance. This is often someone who has the power to make executive decisions. They will have the authority to allocate health center resources. And most importantly, perhaps they're someone who has the big picture vision to ensure alignment of the MLP legal services with health center priorities. I just to kind of tell a little bit of my own story, think that my sustained success with MLP really requires crediting the FQHC, the Federally Qualified Health Center CEO, a woman named Virginia Rogoff, who was not only a staunch advocate for the MLP, but also became a personal mentor for me and a thought partner in aligning the work of legal services with healthcare services. So I am a champion of the administrative champion. And our third one that we talked about was case management champions, right? These are folks who are kind of a bridge between the legal team and the patients. Sometimes they're case managers, sometimes they're medical social workers, sometimes they're community health workers, but regardless, this is about having someone who can help the legal team understand the relevant patient needs and how those manifest, what the patient context is, and who may also act in some very real way as part of the legal team itself, right? They do that. That's kind of a bidirectional relationship. So these are folks broadly who are providing incredible value to the MLP, and it's probably in kind. Still, I think that, and I'll ask Jay to jump in here as well, I suspect he'll agree, I think that capturing their efforts in the budget is consistent with this idea that MLP is a partnership, that it's a collaborative approach, right? That if our value proposition is at the intersection of healthcare and legal services, then you've got to include the champions as part of demonstrating the benefit of MLP.
Yeah, I don't think I can add too much to that. At first so our story, again, I'm not going to go into it as in detail as Keegan did, but you have to evolve with your project, and where do you start versus where do you end? And somewhere in that middle ground, I think it's important to have the confidence to take the leap to include these really important critical aspects, the support for the time of the clinical champion, this support for the ancillary things that the law students or pro bono attorneys or some of the other folks within the health center, such as the social workers, are doing in terms of the kind of interdisciplinary support that you need. I think that you should not be shy in looking at least an initial draft of a budget to include support for these critical members of the team. I think I put that in the chat as well, that it's a complex algorithm and the health center dynamic may be very different, for example, than Marie, what you were talking about in the hospital system, right? That's a totally different dynamic that has very different pockets of discretionary funding. But wherever it is that you're going and whatever kind of synthesis that you're trying to provide for, looking at some of these really, and again, a lot of it will have to do with what are you developing for your MLP? What are your outcomes? And I think that we had an internal discussion of the chicken and egg with context, and what are your outcomes, what are your goals, what are your aspirations, and then you can kind of take a step back and say, well, these are critical members of the team and we really should support them through our budgeting process, whether or not that comes to fruition or whether or not that gets categorized as in-kind support, which also is really important to put in your budget as well, because then funders will understand the breadth and the depth of what you're looking for the next grant or for an adjunct grant of what you're already doing.
Yeah, absolutely. Right. So the in-kind part may be current, but aspirationally thinking about, you're asking other professionals to give their time and you want to capture that. And I think in particular with your clinician champion, that can be really important because many of them will have a requirement to see so many patients per clinic, per half day often. They have this these targets, RVU targets, relative value unit targets. And if you're taking away from that, that may kind of engender negative feelings. If you are starting to think about this as a value add in kind now and aspirationally in the future, financial support for their administrative time that they're using for the benefit of the program, that's the kind of robust approach to budgeting that can be really generative and that can create the kinds of opportunities that Jay just mentioned to draw down more funding. So let's do another poll. Whose budget includes clinician champions, administrative champions, and case management or community health worker champions? We're not going to differentiate now whether it's in kind or whether this is a dedicated, dollar amount in the budget. But who's even putting it in there as part of the budgetary conversation, as part of the value proposition that your budget seeks to engender? And we didn't give you a none of the above or other option, a little bit lower numbers. Yeah, if a person falls into more than one bucket, then you can pick one here. You can put both because probably they're never taking off both hats. I can think of one example as I give you all just maybe 10 more seconds to finish. One of my MLPs, administrative champion, was also the director of pediatrics and the CMO of the organization, right? So he's acting as both administrative champion in his role as chief medical officer, but also a clinician champion and for pediatrics in his role as director of PD. And of course, that means there were other clinician champions who could talk about other lines of service within healthcare. All right, so it looks like we have only about 15% of folks who are including their clinician champion. And as I said, because they have these, they're often called RVU targets in terms of how many patients they're seeing, this really can be an important number to include. 38% administrative champions. That's amazing because I think these folks, making them your best friend is really, really important. And then over half of folks who are including case management or community health worker champions, which I think is great. I suspect it's because they are the ones in some ways that feel most like our allies, like they're the easiest allies. They feel most like a different version of the legal team in a lot of ways, but whether we're thinking about this through the lens of an attorney or whether we're thinking about this through the lens of doing work on social determinants of health, on medical drivers of health. So excellent. So I'm going to ask the same question that I asked before, which is someone to volunteer to raise their hand to unmute. and give us an example of being more expansive in terms of thinking about what the health center is bringing to the table. Are there other champion staffing that's part of your budget? Brett, thank you so kindly.
Yeah, hi Keegan, great to see you and be part of this webinar. So I have a kind of a question actually in response to your question, which is that we have champions that provide services who we are limited into how we can budget for them because of union rules in the shop, right? So there's caps on how much certain folks can be paid. And so we're looking for ways to compensate or acknowledge the work of the champions and make sure that their work is budgeted and compensated in less traditional ways. So sort of a question, sort of a comment, and just sharing something that we're wrestling with currently.
Is anyone else wrestling with that? That's a fascinating question. It's almost the inverse of the way I suspect that most of us think about restrictions on the ways that money is spent, the ways that people are compensated within MLP. I'm not surprised that if anyone would have this kind of inverse, that it would be you, Brett. But for those of you that are not familiar, you kind of work MLP backward, right? Almost LMP, if you will, starting with the legal services, which is a fascinating model that you all should take a look at if you're not familiar. Anyone else or anyone have a response? Jay, Bethany, have you seen this? Do you have insights?
And I don't know all of the rules as it pertains to the various unionized workers, but in the chat I did, in response to Brett Stark's question, think more broadly beyond salary to things like supporting, if possible, alleviating the expenses related to training and development needs or some of those indirect costs, outside of salary. So looking at the broader needs of that staff person and saying, how can the funding that you might be searching for be able to support them beyond salary?
Yeah, and the only other thing I would add, and again, I'm shooting a little bit in the dark here because I don't know the specifics. Obviously, Keegan knows far better than I, but Brett or other folks, one of the models that I adopted along the way was to not augment or to supplement the existing line item that the individuals were being paid, but to pay for a part of it. So we're not adding any additional funding to their existing line. We're supporting 10% of it from a different source, so that alleviates a little bit of the burden from someone's existing either responsibilities or the individual organization that is supporting them. So it's the same thing, but you're not paying them additional money. This is an additional responsibility. Again, that works a little bit different in the clinical setting because it's protected time versus administrative, et cetera. So without getting into too many of the details, the workaround might be, can we support some of that person's time in terms of percentage rather than we're supplementing the existing line item, or we don't want to breach the rules of the contract or the union contract. But again, I'm just kind of I'm positing that just totally off the top of my head.
I mean, it makes sense to me, Jay, because part of what I hear is therefore an opportunity to kind of question the premise just a little bit of the restriction. And I think that's some of the larger idea that we're trying to get at here in thinking about your budget as a prospective document. And that may be including the real number, so to speak, as opposed to the number that's paid is a chance for some strategic planning and further conversation about where these parameters may not be working. Thank you for that. That is a great inquiry. Let's go to other staff. I think it leads, quite nicely into this idea that there are other people beyond lawyers and doctors, don't tell, that are essential components of our work in medical legal partnership. So this can be everyone from folks who are providing project management, which, probably gets counted frequently, but also administrative support staff. You may well be checking in clients right alongside patients in a way that actually changes the work processes of your front desk, for instance. Are you capturing that additional training and knowledge that they have to have, as well as the time that takes? This could also be folks who are maybe a community health worker or something who is tracking down patients who've been referred but were kind of lost somewhere in the process. Could be folks who are engaged in administrative tasks or data entry or going to get another set of medical records or whatever, right? Capturing that full robust team that it takes to do this work collaboratively is really the point here. Interpreter services is a line item for probably both the healthcare center and the legal services center, and it needs to be allocated. If you are working with a population of patient clients who speak a language other than English, then reflecting whether it's in-house staff or whether this is a third party, often phone-based service, is something that needs to be captured. I think that's particularly true if you have limited services and are not able to work with certain languages, for instance, because those services need to be expanded. We want to capture that. And then finally, health information experts. Honestly, I think these folks also need to be your best friends. These are the folks who make the screening for health harming legal needs, who make the use of the EHR in fully integrated models possible. They are key team members for developing reports, for analyzing trends, for moving from patients to policy, whether you're looking at institutionally what the opportunities are, whether you're thinking systemically, here's a law that we need to change, right? And that takes time. It often takes them coming up to speed as well on what MLP is and what are the data points that you want to capture. How do you want your referral set up within the EHR? Because out of the box, it probably doesn't include lawyer. It should, it should, and we'll get there, but it probably doesn't. So, right. So you're probably having to make other changes. And we want to capture those folks as well. So let's again turn to a poll and ask the same question. I'm trying to strive for some consistency here, as well as some learning for those of us that are in the fortunate position to get to read and write and think about these things and advocate for the field. Who's including project management? Who's including admin, support staff? So many of you that maybe let's have a conversation that's breaking that apart a little bit. What about interpreter services? And what about your informatics experts? So I'm seeing the numbers continue to go up. Jay, of course, jump in if you have additions here. All right, well, let's call that good. It looks like, if we can share the results, it looks like fewer than 1 in 10 folks are including health information. You're the IT team, if you will. I think that's something that needs to be part of the programmatic budget. Again, even if they're doing it in kind, what would it look like to value that service in terms of dollars? Interpreter services, almost half are including that, which is a little bit surprising. I think that from the legal services organization, from the big funders, we had a requirement to track interpreter services by department. So that may be an opportunity for folks to grow. And then 75%, this is where I want to take our unmute opportunity. Who is either including other staffing, or how does this project management, other admin support staff break down? So yes, raise your hand to unmute. So who is including other staffing in their budget? Like that's the question. Christina. Did we lose you? Oh, can we get her unmuted? It looks like
Christina, if you raise your hand again, give us a moment to actually hit the button to get you into unmute. All right, go ahead, Christina.
Okay, sorry, I couldn't find the unmute on my screen for whatever reason. So my program is kind of interesting because I'm at an academic health institution, and so we have lots of different departments that we kind of try to all work together to I guess share costs. So for our like administrative costs, like we just hired a project manager within our department, and I'm in pediatrics for specifically our population health group that works specifically on addressing non-medical legal partner or non-medical drivers of health. Sorry, I'm thinking of the word. I'm having a brain fart. But so non-medical drivers of health. And so part of that is also to help with our medical legal partnership, some of the administrative costs of helping with working with the different partnerships that we have to work with, including our legal partners. And ours, we're like partnering with the department I have somebody in the School of Public Health who helps with some of the informatics. In addition to one of my colleagues who is getting trained and working with our EMR in buildings, and also partly part of her time is paid out by our School of Bioinformatics as well, that we're all trying to work together and kind of, I guess, share and pool our funding for people to share different tasks. I don't know if that makes sense, but we're trying to share the resources that we have together for people who have the different times to help with the different projects.
Yeah, if I can jump in for 1 second, Christina, I mean, so what you talked about is really a benefit and unique oftentimes to the academic medical center, where you have the opportunity to pull in different individuals who have a specific interest and who also may be, you know, excited about the possibility of working in that interdisciplinary setting. I think about the opportunity to look at graduate students, for example, who are doing public health, you know, particular rotations, or the specialty maybe in informatics, or in you know, looking at data analysis in social determinant aspects. So the opportunities based on who the affiliations were, especially if there's an academic affiliations, are really rich and broad, and that can be put in the in-kind column, as opposed to if it's a one-on-one relationship with a particular health center, then you probably do have to build in the specifics or look at partners in the community like a School of Public Health or informatics, you know, program where people may be able to come in and do externships or something else. So, you know, the ability to draw people in, you're at a base level with an academic institution that makes it easier, but the creativity of looking at different potential partners who may be interested in collaborating is also something to consider.
Yeah, I think that's definitely something that we're looking at. We're at my institution, we're still relatively new to the medical legal partnership world and trying to, figure out how to improve our services. I think I saw, talked briefly about like including people to help evaluate the program, the efficacy and efficiency of our programs too. So as we build, I know it's always difficult to figure out, and I know Keegan and I have had discussion about this, of how we want to, as we build our program, how we want to define what a successful program is on both the legal and the medical side.
Yeah.
But yeah, it's a work in progress that we're trying to, and I think a lot of us here are trying to figure out how to budget and get the resources we need to do that kind of work.
Yeah, don't feel bad. Medical Legal Partnership is well over 25 years old, and it's a work in progress. So don't think there's some holy grail out there that you're going to achieve because you bring an evaluator in. And Bethany probably can comment about, I think we're going to cover that a little bit later as well in the series, or talk about it a little bit more in depth. But that is the be careful what you wish for question as well. So where are you going with that? What are you putting into it? And how do you do it are all critically important questions.
Yeah, and what lens do you use, right? Because there's the medical kind of hard sciences, RCT, there's public health, there's legal, which is much more qualitative, but has its own, or can be quantitative too, has its own kind of lens, right? How do you do that? Who are the folks who are doing that? Bottom line is, if you're doing that, or if you aspirationally want to do that, which I think if you're not there, you need to get there. That's got to be part of your budget, whether you're reflecting in kind now, or whether you're thinking about, let us go ahead and use this opportunity to spell out what we would do with a windfall, right? Making those plans, having those conversations in advance can mean that you are, that you're ready to take advantage of opportunity when it presents itself. Okay, last bucket as we come to the top of the hour is technology, travel, miscellaneous items. This is kind of everything else, right? Your budget should include technology because no one's getting software for free. It should include the other things that you need to access the software, to contact clients, patients. Should include travel. That's probably particularly important for MLPs that are rule-based, which are, I think, more likely to use a referral network kind of model, but it may be true for others as well. And then there's the miscellaneous things like supplies, like promotional materials, like, we all learn very, very young that if you have food at a training, you will increase your attendance, right? And like one-pagers, the training materials that you create for patients and for providers, these all have actual costs. They have an impact on your budget and should be fairly easy to include because of that. But they're also an opportunity to think about the value of the services that you're offering, and the expenditures, not just in financial terms, but more broadly, what it's costing you to be part of the partnership. Okay, so one final poll here. Who is including these things in their budget? I suspect that although they are hard costs, many folks don't include them all. But let's see. So it looks like most folks are including, oh, the numbers are changing. I should pause for a moment. Okay, let's do about 5 more seconds. 4, 3, 2, 1. Okay. 30% of folks, we can share results, say that they're including technology, 40% travel, 30% miscellaneous. One of the comments in the chat is that these are easy to include in the budget if it's direct cost, but not all funders are receptive to a budget that includes indirect costs. I think that's absolutely accurate. But don't forget that there can be a version of the budget that's internal, right? That helps you capture these expenses and think about what it would be to grow in these areas, what it would be to be intentional about using these as opportunities to sustain your MLP. Okay. Oh, I'm sorry. This one's, yeah, not multiple choice. It was not intended to be single choice. That is mere oversight. Okay, so let's maybe very quickly see if anyone wants to volunteer to talk about anything else that's part of their budget, anything else that we haven't captured here that you know, really these are learning opportunities. So where are you innovating? What would you share? You can raise your hand, and then that actually gives the hosts the opportunity to unmute you. And it's all right if there's nothing else. I could think of a couple of other things that that I always like to include in the budget. One is financial outcomes for clients. Now, is that a programmatic expenditure or revenue? Not exactly. But could it be indicative of the value that the program is bringing? I think so. Could it be indicative of unrealized reimbursement for the health center? Well, with certain kinds of legal cases, absolutely. I'm thinking in particular about SSI, supplemental security income, one of the types of disability that is linked to Medicaid. That's actually retroactive, right? So including thinking not about things like financial outcomes, not just as benefit to clients, but also benefit that maybe needs to be captured within your budget as part of understanding it as a strategic planning document. It could very well be a lot of opportunity. Okay. One of the other comments in the chat is that is a reminder that all of this is flexible. It has to be flexible because you want to be able to adapt to data in real time. And I think that is that's just such an important comment, that this isn't something that gets created once a year and is put away and you never look at again. This is an opportunity to engage in a continuous dialogue and to lift up that strategy that you're meaning to employ as part of your partnership. So speaking of, let's go to the next slide. And I want you to also think about the ways that your budget could include categories, even aspirationally, that would help solidify those current other categories, the current investments, in order to weather future storms, right? We all know in this space that funding shifts, that funder priorities shift, that revenue changes. You know, I think about the many programs that were reliant on IOLTA funds, interest on lawyers' trust account funds, and the downturn we saw several years ago that had serious impact. So what else? And I think I mean this if anyone wants to have a conversation about it. What else would help you protect those current investments? What else helps you fatten your piggy bank? And what other kind of investments now would create financial opportunities later? Where are other opportunities for your budget to reflect your programmatic values, right? I think what we're trying to drive at here is that you can focus on creating a budget that embeds the value proposition of MLP within it, right? One way I have seen this question asked that I think is a lot of fun is if your funders were going to pay you in something other than money, what would they pay you in? Right? What would you want it to be? If you were going to get funding in something other than money, what would you want it to be? So I'm going to let everyone reflect on that. But I think some of the key takeaways that I've heard throughout this conversation before we turn to what are the actual hard sources of funding that we're seeing across the nation are that we want to think about budgets as living documents, right? We want to think about continuously measuring against them. We just saw that in the chat, that this is not just about financial terms, but also an opportunity to measure. Oh, we're getting great comments, right? Respect and food. I love the food, right? Gratitude, paid time off, right? These are all things that can be reflected in a budget if we understand it, not just as a financial document, but also as a values document, right? How do if you got a small windfall, what would you do with it? Is that in your budget now? Or is your budget more driven by what are called in the kind of finance world vanity metrics, right? Are you focusing on statistics that maybe look spectacular on the surface but don't necessarily translate to meaningful results, programmatic results, right? Or does your budget have outcomes and key results, right? I think we're seeing time, direct assistance, money for patients. Oh, sure, absolutely. That I have seen, I've actually put specifically into a budget, and we were able to realize it. In fact, to have a pool of funding that could help offset the costs of filing petitions for a particular type of case for a cohort of a population.
Well, one additional
yeah.
thought, especially given this present slide, is if you're looking to solidify the current investment as a precursor to your future opportunities, does your organization or are the folks in the health center, do they have dedicated folks, and many of you I'm sure do, to look at potential development opportunities that are specific to medical legal partnership, right? So if you already have folks who are really good at what they do, and I'm sure a lot of you do work with them, and certainly in the larger hospital systems, there are development people for obvious reasons. Are there folks that, however, where there may be a dearth of those development folks who can dedicate some time to MLP, could you bring on a consultant to work as a development specialist for a short amount of time or a small amount of money, but it might be worth the return on that investment tenfold? Is there someone who's very adept or a consultant you can work with who can look at different sources locally, regionally, that are invested in the idea or need to learn about medical legal partnerships so that you can then start building a development team even within your own organization specific to MLP, as opposed to the annual campaign for the legal aid organization or the hospital's development folks or health center. So think about that in a very narrow way. Is there a potential for directing dollars in a budget for someone who can work directly on the MLP on an as-needed basis?
Yeah, 100%, right? The idea is that we're all making resource-related decisions. We don't want to be making them on the basis of intangible concepts, right? On our gut, on skills. And I think we'd all also like to get to a place where we're not having to be solely dependent on the preferences and inclinations of funders. And so the budget is an opportunity to shore up your mission, to reflect your mission, and to make sure that that you are allocating resources, whether current or future, to the programs and services that have the greatest impact. All right, so let's turn to sources of funding, potential sources of funding for MLP. We've got a couple of resource documents for these, but on this slide, we have summarized health and healthcare and public health resources versus legal resources, and done them in categories ranging from federal to state, to kind of federal state hybrid to state and local, and then into other. So starting at the top with HRSA enabling services, I'm actually going to ask Bethany to come back on and talk to us a little bit about both enabling services and case management services under HRSA for people who are at MLPs in federally qualified health centers or federally qualified lookalikes.
Yep. So I'm gonna speak while Reha adds me back to the spotlight. For the health center folks that, Reha, you may want to just try again, but it's okay. So for the health center folks that are utilizing HRSA enabling services dollars or Section 330 funding, first and foremost, it's really important to review the Table 5E service descriptor language to understand how you can utilize that funding for civil legal aid services that are part of your medical legal partnership work. It's really important to understand the parameters and restrictions related to that funding and how health centers are even able to use that grant funding. They have to go through a process related to their project scope to be able to tap into it for specific purposes. And so at the end of the slide deck, we want to make sure everyone knows that if you are in that sort of phase of conversations for your health center MLP, where you're evaluating Section 330 enabling services dollars, it's really important to work very closely with the health center staff that are actually responsible for managing that grant, and then they will reach out to their project officer at HRSA. And we also have a link to the BIPIC Q&A form that we would advise everyone to go to, and HRSA loves hearing from people with these sorts of compliance related questions about how to tap into these dollars the right way. But there are, in fact, enabling services dollars that are available to support medical legal partnership. Just have to be careful about how to utilize it. And then Keegan, I'm not sure if you wanted me to comment on Medicaid yet or hold.
Yes, absolutely. But just to summarize, so folks want to look closely at those Form 5A descriptor language for enabling and case management services, right? With HRSA.
Correct.
Okay. Yes. Tell us about Medicaid financing. This is quite literally the $100,000 question.
Or more.
Or more.
Or more. Yeah. So as we think about sustainable funding for medical legal partnership, folks may have over the years seen that the National Center has put out resources and materials to help guide folks in terms of leveraging Medicaid financing as a way to support the financial needs of their medical legal partnerships. It's really hard. It is not easy. But in the last couple of years, under the current administration in particular, we've seen CMS provide guidance on how, in the space of Medicaid, CHIP, and even Medicare, you can really utilize existing authorities to tap into financing to support those health-related social needs interventions, such as the legal services that are provided by MLP. But there are a lot of, again, rules and regs that you have to be careful to follow to be able to tap into this financing. I'm just going to, in one fell swoop, say that number one, if you're looking at state Medicaid waivers, such as 1115 waivers, sure, that might be a pathway, but it's not very easy because you have to work with the state Medicaid agency. They're going to deem it a priority or not, and then they still have to submit that to CMS to seek approval on that waiver application. So that's one route, but it's not the easiest. And right now there's a logjam at CMS. As we present this webinar today on March 28th, 2024, there's a logjam at CMS to review waivers. So the other way when we talk about Medicaid financing is to not forget that most states are managed care states. And so managed care organizations can work separately, and some of them already are and have been for a few years, been working separately to develop partnerships with legal aid providers to address some of those health-related social needs. And they might be tapping into their own administrative dollars to be able to provide some sort of funding, whether it's a reimbursement model or a grant, to support the medical legal partnership work that helps to keep their members healthy. So hopefully that's helpful. I also saw way earlier in the webinar, there was a comment to this effect as well. regarding tapping into Medicaid financing and working with the MCOs to provide more sustainable funding for medical legal partnership services.
Yeah, I think the one thing I would add there is that understanding your budget as a strategic planning document is quite critical to sustaining that work long term. One of the most interesting conversations that I have had with a major health plan in terms of their funding of MLP work is that because it's in that administrative dollar bucket often, and there's reasons for that we could talk about, it makes it subject to shifting priorities. And so you really have to understand that financial ask as more than just about the dollars. It's also about the value that you're adding. In the interest of time, I don't know that we need to go through all of these. If anyone has any questions about any of these, we can certainly talk about them. What I would say is the bottom line is that we see innovation happening all across the country in terms of expanding funding sources for medical legal partnership, and that the reason that we focus so much on understanding opportunities within the budget is that will work as a strategy for almost all of these. It probably doesn't work for the fellowships programs by themselves, but it works for creating sustainability out of those. So let's do one final poll, and then we'll leave the last few minutes for general questions and answers. And this one is learning for us, I think, as much as anything. And it's about, and hopefully it's multiple choice, looks like it. It's about what funding sources you're using. Which ones are you already using, both from a legal standpoint, from an academic standpoint, and from a healthcare standpoint? It is the final poll indeed, so please participate. All right, about 5 more seconds. Okay, looks like folks are over half of folks report using legal services corporation funding. For those of you in healthcare, this is a congressional agency that provides significant, huge amounts of funding relatively to legal aid organizations across the nation. We see the state version of that, state civil legal services, as a significant funder. Law school clinic funding, this one's interesting because it often is that state funding as opposed to some independent source of funding. Other philanthropy in the legal sector, over a third of you have other, and 18% say none, we use only healthcare dollars, which I think is a fascinating trend. On the healthcare side, a third of folks are using enabling or case management services dollars. That is really exciting. 13% health plan, 33% kind of that administrative line item. No one's reporting medical school funding, and there's perhaps some reasons for that in terms of the way we phrased it. Health-related philanthropy is the largest on the poll at 80%. Other health services funding, and then none, we use only legal services dollars. I suspect if we'd asked this question, Bethany, you can tell me if you disagree, just even a few years ago, that many folks would have been in that category.
Yeah. I also have a separate comment as well, so
Yes, please.
Yeah, I just want to know a couple of things, because I put it in the, we see how much LSC funding or Legal Services Corporation funding is going into supporting medical legal partnership. And so, that speaks to the participation, the great participation of the legal aid organizations and attorneys and their staff around the country to support medical legal partnership. But it also there's an important point to be made here, especially as LSC is celebrating its 50th anniversary this year, is that this organization, LSC, this federal agency, is terribly, terribly underfunded. And I don't think a lot of healthcare organizations that partner in medical legal partnerships understand that. And so they've been towing the line, and it's heavy, and it's getting heavier. And we're seeing the justice gap, which grew during the pandemic, leave a lot of the same exact populations that are served by the low-income patient populations are served by health centers or dish hospitals. The LSC funded legal aid organizations are really picking up great weight. And so it needs to be spread out, in my opinion, a lot more, so that we can see, these other legal services funding or philanthropy or law school clinics or state-based funding sources more balanced in terms of the investment in keeping people healthy and achieving justice. And so just wanted to add a little bit of commentary there, so that if healthcare folks aren't aware and are also, similarly trying to find sustainable funding sources for healthcare services, the M and MLP, just note that the LSC funded legal aid organizations, it's very, very underfunded. But you can see how invested that field is in this cause, which is also a thank you to LSC and thank you to the legal aid organizations for all that they're doing in MLP.
Yeah, absolutely. Yeah. And we could certainly get into those numbers as well. We've given you some examples on the next slide of the ways that some health centers have grown from year 1 to year 2. These are 3 very different examples. Starting with a small grant that enables access on a specific health harming legal need for a specific patient population. The second one has shared operational costs that they use as a pilot, and they're focused again on a specific population with a specific kind of large category of health harming legal needs. And then a 2-year pilot based on the terms of a major legal fellowship funder. Bethany and I both are alumni of that approach, so we're happy to talk into detail. But on the next slide, we see that those year 1, and this is true whether it's a true pilot or whether it's an expansion, turned into, at year 2, on the next slide, please. Opportunities for expansion, right? Taking, and the bottom line here, I think, is recognizing that even if you are working with a small amount of money, it doesn't mean that your budget should not include big ideas. And in each of these examples, those big ideas are what led to a growth the following year in opportunity. I will give you very briefly my own example, which was starting with a legal fellowship with an Equal Justice Works fellowship, and then turning that into subsequent Equal Justice Works fellowships and other legal fellowships as a kind of ever expanding model. And the budget every time reflected those perspective ideas. Here's the thing that we're going to do next. And here's how we know that we're already ready to make that ask. And in fact, I think we did that 6 times within the same number of years. So it is definitely doable. Some key takeaways on the next slide. Regarding thinking about budget, thinking about how you're going to pay for it as a strategic process, because the goal is, of course, to build a sustainable model. What all of these come down to is a reflection of what Bethany was just part of what she was just hinting at, which is that legal services broadly is underfunded, even though it does incredible work. Hasn't grown actually in 40 years or so. It's fallen, in fact. And what that means is for MLPs is that there's often a patchwork of funding streams. that we want to see direct funding. It's a partnership. It's not legal services doing all the financial lift, right? And et cetera. And the really big thing here, planning for future funding is critical, right? That budgeting is an opportunity to strategically describe your actual and prospective programmatic needs in order to create that culture of health justice. We are at the bottom of the hour. Any final thoughts, Jay and Bethany?
We're coming on to join you. Hold on, give us 1 second. We're rejoining you on the platform here. I just want to note the interactivity in the chat, folks also offering each other help. And so I'd actually like to use this last second to encourage people to continue to do exactly that. Try to connect with each other so that you're not just interacting on this live webinar, but also between sessions, so that you can share your own knowledge and experience as resources to help sustain your MLP and tap into additional funding sources as well as strategies. Let me shut up so that Jay, one of our lead faculty on this webinar series, can add.
No, I think that as you can see, there's a plethora of different opportunities. My parting words would be bold and courageous in your budgeting strategy, because whether you view it as the chicken or the egg, you are empowered with the opportunity to match what you want to do with your MLP through the process of thinking about A, what do I want funded, and B, why, and then C, where do we go for that funding? And you may have to make adjustments along the way, but if you make a long list of all the things that you want, there's ways of putting them in the budget, whether they're direct or indirect costs, that I think will also fulfill the idea for folks who are looking at this, that this is a pretty impressive interdisciplinary project, rather than, oh, you know what, we're going to hand a card to a patient so they can call a lawyer. It becomes truly that kind of synthesis of this whole process that we've been talking about over the scope of the webinars, and that will really boost and enhance your opportunity to provide a mechanism for the what and the why.
100%. There are a couple of resources in the end of the slide deck for those of you that are interested in learning more about the financing streams. And with that, thank you for being here.
Can help us close out the webinar. Keegan, don't leave, because I want to make sure we ensure that we thank you and Jay once again for an awesome presentation. As Keegan mentioned, there are resources in the slide deck, some of which have been added to the chat. Please join us again on April 18th. Reha has also provided a link to the registration for conversation number 5. Again, you'll hear from our lead faculty, Keegan Warren and Jay Sicklick, about how to develop a really strong partnership agreement, or that memorandum of understanding or agreement for your medical legal partnership. That's what keeps things moving forward smoothly. So join us again for that webinar. Register now. Share the link with your friends. Again, Keegan, thank you. Jay, thank you. And we also want to sincerely thank everyone for joining us today, stepping away from your day-to-day to help us help you advance your medical legal partnership work. Take a moment to fill out our SurveyMonkey link to our evaluation and let us know how we did, as well as how we can improve. Thanks for joining, everyone. We're closing out. Take care.